All right, we're going to get started. Welcome, everybody, to our new bi-weekly COVID-19 virtual town hall. This is our first one in 2 weeks, so we've had a little gap in between. If you are a first-time caller, long-time listener, you can, or vice versa, you can ask questions in the live chat, or you can ask. Hold on. I got to mute this. This is our first one in 2 weeks, so we've got a little gap in between. If you are first-time caller, long-time listener, or vice versa, you can ask questions in the live chat, or I have more than one video open, it turns out. Okay, now let's try this. Let's try this again. Sans the 5 different windows playing the same thing. All right. So you can email us at covid19.questions@chw.coos.or.us. You can add in the live chat box anything you'd like to ask as we go along here. And Brian, do we have any major updates we want to give, or?
I certainly can't think of anything.
Oh, good. That's how good it's been. It's been fairly quiet, which is nice. We if you don't know, we are in phase 2 now, which affords us a little more flexibility as a community to do some of the things that, I mean, we have been, or the community has been asking to do. If you have questions regarding that, there's a possibility we can answer some of the questions. Any real high level breakdowns of the sector guidance is still something that the OHA is requesting that they take care of, if I'm not mistaken. Right, Brian?
Yeah, I believe so.
Perfect. Where did my questions go? So we do have some questions that we have picked up throughout the last 2 weeks regarding some of the happenings. First question is, Brian, I bet you can't guess what this question is about.
I'm not going to try.
I bet you would be surprised if I told you there was a question regarding Shutter Creek. If all the positive Shutter Creek inmates were shipped out of the county, how many actually active cases do we have in Coos County? 6. And then they break down the count. They see it as 1 former inmate, 2 Shutter employees, 2 presumptive positives, and 1 actual positive.
Okay. I'm still a little unclear as to exactly what the focus on is for the term active cases. If we are basically talking about out of all of our cases, who remains in Coos County currently, that may be correct. That's not something I've went through and counted. We typically look at our total number of cases that we've had since the beginning, and then we also look at the number of cases where we are still, for example, monitoring their close contacts for symptoms. In some circumstances, there have been individuals that have been waiting to go back to work and have been, doing follow-up testing based on the Department of Corrections requirements to go back to work. But as far as a total number of cases that are still currently in Coos County, even the ones that are way past the point of, we're worrying about whether or not they're still infectious, That is not a number I have put together. I think as a guess, the potential for that is probably just a couple of the cases. But yeah, I'm not 100% sure what they mean by active, I guess is the best way to sum that up.
Yeah. I think I mean, ultimately it sounds as though they just want to know how many cases aren't Shutter Creek cases, like community cases. So
yeah, actually though, I do actually have an update in regards to Shutter Creek. There have not been any any positive tests coming from Shutter Creek for viral testing in quite some time. In fact, I was notified by OHA today that the official end of the Shutter Creek outbreak should be declared this week. So that's great news. Again, cautious optimism, but there's certainly been a lot of follow-up testing. There's even been some antibody testing to just try to get an idea about whether or not some individuals may have demonstrated a little bit of having been exposed, even though they didn't end up becoming ill or test positive. So that should be interesting to check out. But yeah, there have not been an actual viral test positive in, and I think it's been about a month now. I think it was around this time last month that we got the last wave of asymptomatic positive tests for adults in custody.
that's good. Considering where we started, I think that's a pretty big accomplishment, big leap.
Yeah.
Terry had a question. I don't think we have an answer for, but the question is how many persons over the age of 65 have been tested in Coos County?
Yeah, I definitely do not have a number for that. Yeah, I'm not. I think there could be a way that I could potentially pull that report, but I'm not 100% sure.
Sure. Gary says, is Coos County open for travel? We have a short vacation planned for Bandon the weekend of June 11th to the 14th. It's funny. I was watching last week's town hall, and we discussed someone else that had a trip from, I think they were coming from Sacramento on the 19th.
Yeah.
And at the time we were about halfway through phase 1. And it was funny because we were like, well, right now, no, but by the time the trip comes around, you should be fine.
Right.
And they do say the governor's guidance since we started phase 2, which was last Friday, the 5th, does say you can have extended travel. It doesn't really put a cap on what that means.
Right.
So really, people can start vacationing again, probably, given that they take proper precautions.
Yeah. And I would add, a lot of that depends on it's because it's not just Oregon in the case of somebody that's coming from out of state, right? It's also what is the state you currently live in? What is their guidance? I did talk to somebody last week that was wanting to travel from from Alaska. And currently they were being advised that, go ahead, knock yourself out, leave Alaska, but we're going to require a COVID-19 screening test before we let you back. So definitely check with your states. A lot of the guidance for your state, if you're thinking about leaving, may not necessarily obviously apply to you because you already live there, but certainly take a look and see if there's anything special that they would require to re-enter your state.
And I'm unaware of any such guidance that we have for those kinds of taking off and coming back. That is interesting, though. You bring up a good point. Like every state's going to be different. The guidance and expectations will be slightly different than maybe what you're expecting. So yeah, check into that. That would suck if you went somewhere and came back and realized you had to be quarantined for 14 days.
Right.
Chris said, are individuals allowed to use showers in fitness clubs? As I was reading through the guidance today, there's no specific new phase 2 guidance for fitness clubs, but there is for pools, spas, and sports courts that do say that if you choose to allow people to use the showers and the facilities, that they have to take the precautions to ensure the social distancing. So I think ultimately it's going to be up to the facility, that wherever you're going, and whether or not they have the capacity to adhere to the guidance.
Mm-hmm.
At least that's how I read it. Ultimately, you should check with OHA.
Yeah, no, that sounds good. And I hope social distancing wouldn't be a difficult feat to manage in the shower.
So what's the current recommendation regarding wearing masks and social distancing? I mean, I think I know what our recommendation is. Right.
Yeah,
CDC recommendation is.
I think if you're out in public, that you should be trying to wear a mask as much as possible. Absolutely. As far as social distancing, that is absolutely still a thing. We in any setting, we would prefer you to be able to stay outside of that 6-foot radius with anybody that you come across. Of course, anybody that's within your household, you know, that isn't a concern.
No, yeah, absolutely. I'm really the things we've been discussing as far as social distancing and masks hasn't changed. You wear the mask for someone else, not yourself, unless you're a healthcare worker and you're wearing a properly fit tested N95, right?
Yep.
But social distance is always a thing. 6 feet, unless you're passing each other. Question on the chat: what precautions would you recommend for staying in an Oregon hotel? I would say it's probably just as any precautions you take in staying in any state's hotel. Hopefully it's been sanitized.
Yeah, I would think the sanitization, you should be able to depend on that. However, out of the abundance of caution, I don't believe there's any rule about you going in and first thing upon entry to do a quick once over for all of the high touch surfaces in the room to disinfect those as well. Nothing wrong with being cautious in that regard.
So if you wanted to take your own spray bottle of bleach and a rag, you could disinfect your room as soon as you get in there, just to kind of be 100% sure.
Yes, a bleach solution appropriately diluted. You certainly wouldn't want to damage any of the furniture right. in the hotel, for sure.
And that the proper bleach solution mixture is on our website at our COVID-19 page. You can find it there if you are interested. That's not a bad idea. People start traveling with their own
caddy of cleaning
supplies. Yeah, absolutely. Sure. Bring your own sheets and towels just in case, I mean, I guess it depends. Ultimately, it does depend on how comfortable you are with whatever situation you're putting yourself in, right?
Right. For sure.
All jokes aside, I mean, that's actually probably pretty smart. I think I might do that.
Yeah.
Carol wants to know what the results for the 100 COVID tests performed in Coos Bay for the fishing industry were. The 88 COVID tests that were taken were negative.
Yes, all were negative. I do believe there's still a few that we were attempting to potentially retest because of a paperwork problem that their original samples had not been able to be processed. But other than that, yeah, we are, all negatives.
I think that was a pretty awesome event for the CDC to come down and help with.
Yeah, and considering a similar event that happened to the north of us resulted in the discovery of quite a few cases, I definitely feel like we are in better shape than some in regards to that. So certainly thankful.
Yeah, that is unfortunate for up the coast, and I'm glad as a public health department we can help our fellow counties in those efforts. So Jake, I'm wanting to know what the guidelines will be for sports, specifically football. There is, Jake, if you are listening, there is a phase 2 guidance on youth sports, recreational sports, and limited return to play for specified sports. So that would be something you'd want to go check out if you have any questions. Anybody has any questions regarding what it means for swimming pools locally, sports courts locally, youth recreational sports. The phase 2 guidance on the governor's website will give you all of the answers they have. And if that doesn't satisfy your appetite for the knowledge, it doesn't answer the question, then you can reach out to OHA at their question line, which I don't have in front of me, but I will get it before this is all said and done. But that's a good question. I know that football is right around the corner. Like, it is June 9th. We usually see preseason football in August, and our kids are daily doubles around the same time, or triples, whatever they do. And sports is a big thing, especially in small communities like ours. Football, Friday Night Lights is a big thing that a lot of people come out together to do. And I know that that's something that is on the hearts and minds of so many. Technically, by the phased approach to everything, phase 3 would be where you can have spectators. Yeah. So maybe they find a way to do football this year, but it may be to an empty stadium. I don't know. I think of a sport that would be hard not to spit on each other. Basketball and football are probably the ones that I think of that would be the hardest to find ways around, or at least as far as from a safety perspective. But that doesn't mean that there aren't answers for those questions. So please reach out to OHA if you do. Let's see. We got another question in the chat. The question is, what kinds of tests were the staff at Bay Area Hospital given when the patient came up with what ultimately was a false positive? How many test kits are there in Coos County? I don't know that we know how many test kits there are in Coos County. I think we might have an idea, but that is something that I don't have the number in front of me.
Correct. It's a different member of our team that's kind of keeping track of inventory for kits as well as PPE. So that's not something that's readily available. It's an interesting question, though. In regards to the first part of that, Bay Area Hospital's COVID-19 case this last week that they sent a press release about is absolutely not a false positive. The release itself did not imply it was a false positive, although it certainly does demonstrate some information as far as follow-up testing and things like that. But there are, we are very familiar with the potential for false negatives. So public health really does not have an intention at this point, regardless of follow-up testing or other circumstances, to downgrade a case from a confirmed status to a no case. Essentially, from any follow-up that I've had with the state, the message has consistently been a positive is a positive is a positive. There is not a concern from a public health standpoint that we are dealing with any false positives. In regards to how they were tested, I'm not 100% certain, but I do believe it was a normal viral PCR test. I'm not sure which lab they were sent to right off the top of my head. I think it kind of depended. But I do know that I do not believe they were rapid tested. I'm not 100% sure about that though. So yeah, I do, from what I understand so far, all the tests for employees and patients that they thought could have been potentially exposed to the person that did test positive, they came back negative so far. I think there might be a couple still hanging out there, but right now they're all negative. So that's great news.
Yeah. No, it absolutely is. Another question with HIPAA, how is contact tracing done?
So yeah, no, that's a great question.
It really is.
I don't know if we've covered that in public very much. It's a topic we talk about a lot on the investigative team in order to be safe and protect everyone's identity and medical information. Typically, when we come across someone that has tested positive and we kind of explain the process of collecting their contact information and discussing, the places they've been and places they may have exposed, people they may have exposed based on certain dates of when we feel like they were likely to be infectious. We do tell those folks that we are going to be reaching out to the people they name, and that their interview is confidential. And so when we do reach out to contacts, for the most part, it's kind of a situation where when we call someone and we start saying, hey, we're under the impression that you may have been exposed to COVID-19. And so we take them through that process, but we don't give out the name of the person. In most cases, those contacts, because for a few different reasons, those contacts already know who we're talking about, but we still don't really confirm who that person is. But yeah, we do definitely make sure we go out of our way to protect the individual, to make sure that, like I said, HIPAA is a very important law. Ethically, it's just a very sound way to operate, regardless of what the law is. And we're certainly committed to that cause and making sure everyone's private information stays as private as possible. I say most of the time, I kind of hedged a little bit earlier, that there are times where, especially in the context of a healthcare setting, we may need to explain to a healthcare worker, who it was that they may have come in contact with. But as the healthcare worker, they really already have access to that information, so it's not really much of a difference there.
Melissa asked, so she's specifically interested in the state's rules on playgrounds that are only accessible to daycare children. I think if it's only accessible to daycare children, like if it's a private playground at a daycare facility, they have the ability to sanitize that, and they screen the kids and all that stuff before they come in, which is different than I would imagine a public outdoor park. There isn't a specific guidance regarding that I have seen, like a sector guidance that specifically mentions that. Melissa, if that would be something that would probably be worth asking Oregon Health Authority to see what their thoughts on that were, because I'm sure you're not unique in that. As far as a question, I know my daughter goes to a preschool that has a playground, but it's only used for them. So good question. Francis said, is there any guidance for holding garage sales? If it is in a facility, such as a large room at Pony Village, would the guidance for retail stores apply? What if it's outside and a family is holding the sale at a house? What about community sale held at a parking lot? Also, do thrift stores have any requirements for handling donated merchandise, which might also apply to community garage sales? There's no specific guidance for garage sales. There are the gatherings of sorts, which would indicate that you can have 100 people outside or 50 people inside, depending on square footage, and it could cross over into indoor outdoor entertainment or venues or general guidance. There's a lot of boxes that could try to tightly fit into. I know that there's a thrift store in town that is operating, and they have you put the stuff in bins and they don't touch it from you. They're masked and gloved. I know that. I think if you're going to have a garage sale, just say hypothetically someone decides I'm going to have a garage sale this weekend, you would hope that you would take the proper precautions, not only for you as the individual having the garage sale, but maybe even requesting that people that are shopping in the garage sale also take proper precautions. But there is no specific guidance to garage sales. And if you do have a question for OHA based on guidance, the email address is covid19.reopening@dhsoha.state.or.us. Barb had asked me to repeat this. It is covid19.reopening@dhsoha.state.or.us. All the questions, Brian. We have another on the chat. Do you need more volunteer contact tracers? And if so, are there going to be more trainings?
So right now, I mean, to kind of put this in scope a little bit, based on what we have and based on the list we were given for, say, the hospital case recently, and we had probably, I think the final count, once we established who fit that close contact criteria, it was pretty close to 90 individuals. And we were able to get into contact with those folks within about, whether it be initial attempts or follow-up attempts, almost everybody within about 24 hours, and probably only about a total of 6 to 7 work hours. So I was pretty pleased with that. We know that we have had a few volunteers that have taken some training, and we're going to be providing them with some more resources as well, that should be ready to, they're kind of in the on deck circle, if you like baseball metaphors. So if you're one of those individuals, then that is something to potentially look forward to. I'm pleased with where our caseload is now and what our capacity is. But of course, things could change very, very quickly with this illness. So.
Yeah, absolutely. We have a question regarding when is Horsefall Beach going to be open? a good question. I know that the state parks are opening some limited overnight camping starting today. I don't know. Horsefall is a national park. It's not a state one. So I'll have to do some looking into when that might be open, Lewis. I think this is the quickest we've ever gone through our questions. And we don't have a lot going on in the live chat. So if you are interested or have a question, we would be willing to entertain the question if it's COVID-19 related. If we go much further without having a question, we might have to go outside of COVID-19 questions.
Stand up routine.
Work on some jokes. No, that's probably isn't the venue for that. I know that there's a lot of people, and I know we mentioned it earlier. We talked a little bit about the phased approach to reopening Oregon. And I think we have to anticipate that we're going to be in phase 2 for a long time.
Yes.
Based on the fact that the governor has said that we need to have a vaccine before we can move to, or treatment, vaccine or treatment, I think is what the language was, in order to move into phase 3.
Mm-hmm. And I would say, in addition to that, it's not out of the realm of possibility that if suddenly we were to have a run of cases, that it's not impossible that we would have to retreat back to phase 1. So,
right.
Please do continue to keep your social distance and wear masks and everything out in public, and we can stay at least where we are, if not hopefully move forward in the future.
Yeah, because ultimately it takes the entire community working together to keep the numbers down, to keep us progressing right through these phases, or at least staying at this point, because at any given moment, if we were to have a large spike in cases, like any other county, I suppose, that could have one, we would have to retreat back to, according to the guidance, the previous phase, which would be phase 1 for us. But we could keep backsliding from there if things were to get worse and worse and worse, right? So we want to ensure that we're all doing the best we can to keep us open. Another question in the chat: when BAH employees are potentially exposed with test results haven't come back yet, are they still working awaiting results?
What was the first part of that?
They asked when BAH employees are potentially exposed. So I would imagine at this point you could put this out to just a more general statement, like if healthcare workers are exposed and have taken a test, are they still working?
No, that's a good question. So generally speaking, and this has actually been the way it is currently for quite a while. I want to say at least a month. There has been guidance from the CDC stating that with appropriate PPE and appropriate symptom monitoring and a variety of other mitigation measures being taken, that it is not required for a healthcare worker to be furloughed while awaiting a test result. So I'm not 100% certain that that's what's occurring in our circumstance, but I know that based on a variety of factors, the hospital would be absolutely within guidance to consider on a case-by-case basis whether or not someone needed to be furloughed if they had not had a test result. And coming back to that topic, as far as test results and negative testing and positive testing, again, we're pretty confident about positive tests results. But as far as negative test results, keep in mind, a negative result is certainly not does not indicate that we're out of the woods with any particular exposure. So the ongoing monitoring of symptoms and careful symptom checking and things like that are going to make sure that we're not only depending on a test result to state whether or not it's safe for someone's work.
Yeah, that's I think that's important to note. There's a lot that goes on with this and how it rolls out in different places versus the healthcare side versus food processing plants versus schools. I mean, there's a lot of different things you have to consider, and each one of those is very individualized. They all might share some aspect, but they all have a lot that is very specific to what it is that they have going on. All right, let's see. It is a quiet night, and that's okay.
All right.
That's okay. Well, I mean, I don't know. Maybe we don't need to do these every 2 weeks. Maybe we can go down to once a month.
That is totally okay with me.
If all's quiet on the Western Front and we don't have any major things popping up, there isn't a lot for people to ask us questions about, which maybe that's a good thing. Maybe we've done a good enough job answering questions that the community feels like maybe they know what's going on. Maybe they feel informed, or they're tired of staring at our faces.
I was gonna say that last part might be accurate too. Yep.
Yeah, might have more to do with it than the former part of it. Is what you're saying?
Yeah, I'm getting more and more gray every week.
I know somebody pointed that out to me. Like, hey, what happened?
COVID-19 happened.
Yep. Do you have anything breathtaking? Any thoughts on the matter?
I guess maybe to kind of reinforce the point we were talking about earlier about continuing to be vigilant about our mitigation strategies. Do keep in mind if you've been paying attention to not just Coos County, but the statewide case results, and of course the aforementioned Newport cluster with the fish processing certainly didn't help matters. But there has been over the last few days, I would say a dramatic uptick in cases for the state as a whole. That does come approximately 2 weeks after the Memorial Day weekend, when we certainly did observe a lot of lack of from the public to use those mitigation strategies, whether those observations were around people that just traveled into the area or were just traveling within the state. It's hard to say, and I'm not saying one definitely is the cause of the other. But we certainly, I think, did talk about the potential for that holiday weekend and people doing their own, barbecues, and it'd been a while since people had, in some cases, had seen family members, and they just wanted to spend that holiday weekend with each other. It wouldn't be a surprise to nail down the fact that maybe there was a connection between the two. So we really just want to, it's getting hotter, it's getting warmer, people want to barbecue, people want to do a variety of things and have get-togethers. Just please be as careful as you can. Try to stay within guidance and try to keep that social distance and everything, because like I said before, it's not out of the realm of possibility that we could end up having to retreat to phase 1. And that's not something any of us want to happen.
And I think you make a good point with the guidance piece. Like it says, phase 2 guidance, right? We can have, you can have gatherings indoors, 50 people, outdoors, 100 people, but it's still subjected to the fact that you have to be able to maintain that social guidance or social distance. So based on, what was it, 36 square feet or something like that per person, I want to say,
Right.
if you did,
Yeah.
if you did the 6 all the way around.
Perfectly measured. Yeah.
Right. Yeah. So if you took your square footage and then divided it by that, then you'd know how many people you could have in your indoor space or even outdoor space. Of course, people want to get together. Like I am tired of staring at your face more than some of my family members' faces, and I get that that's where people are at, but the reason that it is the way it is to keep everybody safe, so like we don't have those spikes like you're talking about. The World Health Organization had a statement, I think, about the asymptomatic people, and we have a question that says, what's the latest theory on presymptomatic or asymptomatic transmission? Did you see that article?
No, but I'm gonna go check it out. Was it talking
I want to
about
say
rate high proportion
yesterday.
cases?
I want to say yesterday, the World Health Organization said that it was unlikely of asymptomatic transmission, and then they kind of rolled that back a little bit today. So yeah, maybe you should look into that. I thought it was interesting.
Yeah, asymptomatic spread, quote unquote, very rare. Man, I don't know what to say about that. It's certainly been something that we didn't really accept based on stories here and there, but I even locally there were, we know there were people that were ill, for example, in Cheddar Creek. We know that the conditions there made it very difficult to socially distance. And then we know later that there were quite a few cases that individuals that tested positive after having no symptoms. So I mean, there were, if I recall correctly, I believe there were 17 people that had been tested and 9 tested positive. So 17 asymptomatic individuals, 9 had been positive. And I know that's a little bit of a different setting, and translating that to, normal real world circumstances out, when there's not such a tightly packed population with a limited access of getting away from each other. But yeah, I'm not sure how we could say very rare at this point, or feel, at least I'm not sure how we could feel confident about saying very rare.
Well, that's kind of what I thought is, were they putting that in the context of, if you're just your everyday person wandering around, walking downtown or through a store, it's rare? Or then you put that same person in a congregate setting like the Cheddar Creek situation, where you are in a close proximity all of the time with people. Is
Right.
It still, I don't think that one thing fits in both boxes.
Oh, okay. So
I mean, I don't know if that's what they're saying. I had wondered that.
So now I'm kind of looking at this again. Now I think it may be the comments are specifically about, can an asymptomatic person, how rare is it for them to spread the illness, not how rare is it for someone that is asymptomatic to be infected, or how rare is it for there to be an asymptomatic case. So
okay.
that is definitely a different conversation. And part of the unknown factor here is we, despite all of the case data around the world and all the information that we have collected so far as a global population, we still are not feeling super comfortable talking about the infective dose of this disease. So In other words, how many viral particles are needed in order to be able to cause infection once there's a route that has been established from another carrier. So we do feel very, very confident in the fact that it seems to be the peak of viral shedding does seem to coincide with the intensity of symptoms. So it stands to reason that someone that isn't having any symptoms at all is likely not shedding very much virus.
Mm-hmm.
And so their infectiousness, as it were, is going to be quite a bit lower than somebody that's coughing and having some pretty acute symptoms. So, and then I guess we really love to talk about definitions and what does very rare mean. I mean, for some people that could mean, hey, only one person in 100 asymptomatic people transmit the illness. But I mean, if you consider that maybe the number of asymptomatic people is quite high as far as the proportion of overall cases, and I'm not saying that is the fact, but if it would still, especially since people are obviously not on their guard around people that aren't actively having symptoms. Those people are getting past symptom checks when we talk about going into certain facilities. So yeah, the very rare I would like to see what. Throw me a number. I would like to see that when somebody says something is very rare.
Yeah, no, that the shedding thing, it's just
I mean, we're still at the phase where we are not convinced that there is we have low confidence in saying unequivocally that the only way to transmit this virus is through respiratory fluids. That seems to be the only thing we're seeing, but we are detecting viral particles in other bodily fluids. So it's definitely I really wish 3 months later after we started having these that we felt stronger about some of the information that people have questions about. But this is going to be one of the most extraordinary after event analysis periods potentially in public health history once this gets done. The sheer volume of people that became sick and potentially a significant amount more than that, more than were confirmed by testing. And after months, this has been so, COVID-19 has been so evasive about even symptom profile. In some cases, it has really just been an extraordinary virus to monitor. It's amazing.
Yeah, it's been a roller coaster as far as the whole thing goes. It's you think that it's one thing, and then 2 weeks later you're like, oh wait, it might be something else, and then you go back to wait, it might be that one thing again, and then you're like, wait, this other thing is also a possibility. Oh, now wait, it has been like chasing your tail, seemingly. But you're right. I think the whole after action piece is going to be very interesting to see how everything really kind of shakes out once all the data is collected and you really can break it down.
And I mean, I can't speak for everyone in my field, in the state, but it's a situation where, a lot of my colleagues have had to spend so much time just keeping up with the actual cases that are popping up there really hasn't been a lot of opportunity to do a lot of analysis on, doing deeper dives and figuring things out that way. But even those, that are prominent in the field on a national level or global level, those they have had the time to to look at data from a lot of different countries and everything, and they're still, probably get a little bit more and more certain about certain topics as time goes on. But yeah, there's still a lot we don't know.
Well, I mean, I'd imagine there's still going to be a fair amount we don't know, even when this whole thing kind of dies down for a while.
Yeah, part of this is, I mean, the whole idea of a coronavirus again is that is an illness that has, jumped from an animal species that's not human to humans and been able to replicate and use us as hosts. So we're already talking about a virus that has an innate capability of doing some pretty rapid mutations. So that might be a big part of why we're having a tough time.
Yeah. It's like the every time you say it jumped from an animal host, it's like, this is how we become zombies. Okay, so another question in the chat. Is it a good guess that the first vaccines will not have high efficacy? Perhaps it will take years to get a vaccine with a 90% plus efficacy? That's a big question.
Yeah, I don't, there are, I think in order to try to explain vaccines, generally we try to really generalize them. And when really, in fact, there are the variety of vaccines that are available to us, we've been forced to take different approaches on a molecular level as far as what we do in order to be able to handle a vaccine. And it's a really, really good question. Sometimes we're dealing with just strictly antibodies. Sometimes we are looking at other potential ways of inoculating folks, but it's a difficult process, and especially like we've been talking about mutations and adjustments. It may not. I mean, really, even if you just consider the fact that testing has been a challenge. If testing is a challenge,
Mm-hmm.
because there are because it's a little like some kind of escape artist as far as identifying genetic material, then it would stand to reason that it would be difficult to develop a vaccine, maybe a little bit more than say others. But the value as far as efficacy, whether something's 90% or 95% or even say 90% for the first year and then down to 60% for the third year, there's just so many different factors that go into that, and so it would be hard to say. If we're looking at just strictly talking about antibodies, for example, I mean, even antibody testing has been demonstrated to pick up other versions of the coronavirus, of other versions of coronavirus that are not COVID-19. Sorry to confuse that. So yeah, this is not super straightforward, and people a lot smarter than me have their work cut out for them.
Yeah, I mean, I guess I would see this would be more of a like how we get a flu shot every year. How you're supposed to get a flu shot every year.
So I would pause on that comparison, only just because there are many different types of flu, and for
no, yeah, I agree.
and so part of the evasiveness with the flu and having to do it every year is because there are different strains that are, we can't pack 25 strains into a vaccine. So we're really just, really just trying to hedge our bets as much as possible with the strains that are included in every year's flu shot. But that's, I guess it's a good thing to consider when you're talking about, if this is a rapidly mutating virus, it's certainly within the realm of possibility we develop a vaccine for the strains we've been working with, and then later new strains pop. So
right. And what I meant by that was like, you've got your vaccines you get as a kid, right? And you never have to get them again, right?
Oh, right.
This isn't probably going to be one of those vaccines as much as it's going to be closer to something like you're going to have to get on a periodic basis.
Yeah. I wouldn't be surprised. But
yeah, I'm pretty sure when I got to boot camp, I got all 25 strains of the flu shot in a needle. It was just this long.
Oh man.
It's we got another question. So will testing continue into the fall when the other flu starts, and will there be funding to continue the testing and tracing into the new year for our county?
Short answer to that, I'm not 100% sure how all of that is calculated. I do know that we've been told to prepare for expanded contact tracing and case investigation for well past this fall. And so I would assume that we're certainly looking at a long road ahead at controlling the spread of illness. So, funding likely is going to go along with that, but yeah,
there's no indication that it's going anywhere anytime soon, right?
Yeah. And as time goes by and we have time to kind of catch up on some of the materials that we've been, that have been in short supply, I would assume that the testing capacity is just going to increase over time. There might be some holes in that argument though, but I think testing capacity will expand.
Well, and hopefully narrow down a more efficacious test.
Yeah.
I mean,
yes,
there's a lot of holes in the cheese when it comes to what the test is good and what test is not good for. So right. It would be nice as this whole thing goes on and they have a better understanding of what they're trying to track and chase, that they can get a test that's a little bit more accurate.
And even not just accurate, but convenient.
Yeah.
If we're really going to be working on widespread testing, maybe the idea at some point would be somebody to be able to just pick up an at-home test and do a little finger prick or do a little Q-tip, or who knows. Maybe there'll be much more convenient testing available.
Yeah, no, that's the hope. But I mean, these kinds of things take time, and
yeah,
I think we've got plenty of that coming. So, but again, we have to work together in order to keep our county in the phase that we're at, and even be prepared to move to phase 3 in the event that we can get there in the near future.
Yes.
Last thing we want to do is go backwards. So we still need to take heed in the preventative measures. Wash your hands, cough into your elbow, sneeze into your elbow. Don't touch your face. If you're going to wear a mask, don't mess with it. Don't wear it like here with your nose sticking out. That doesn't actually do any good. Don't wear it to cover just your chin, because you've actually missed the important parts. Maintain that social distance and be mindful of all of that. I understand that everybody wants to get together and do their thing. And like you said, Brian, it's going to start getting warmer out here in the county. And it's funnier when Barb does the air quotes than when I do it. That we need to be mindful of these things. So before we go, I just want to give I'm sure that there are just copious amounts of graduates listening to our virtual town hall. So I want to congratulate the class of 2020. Probably the most unique graduation year in recent memory. And those students persevered through all of the things that were thrown at them and drive through graduations. I saw, and Brian, I think you're going to get a kick out of this. Being on the North Bend School Board, I was able to participate in the North Bend High School graduation on Friday, to which a girl on her mortar board had, "I can't believe I'm getting my diploma the same way I get my nuggets."
That's great.
I stood up and I gave her a standing ovation. I thought that was an amazing statement. But they did it. They made it in the weirdest of circumstances. So I have to give the class of 2020, for all of you out there listening, congratulations.
Yes, absolutely.
Nuggets.
Congrats.
Nuggets. All right. So we're going to try this again in 2 weeks. If we have another one like this, we'll probably start doing it monthly, so that we can cultivate questions. Thank you for the 2 people that asked questions on the YouTube live chat, and the 11 that asked questions in the COVID-19 questions email. We will, let me look at my calendar because I don't know math. We will see each other on the 23rd. I was getting there, Brian.
Right.
23rd, 5:30, same place. So hopefully we'll see you then with more good news. Hopefully we're 2 more weeks into phase 2 and everything looks good.
Smooth sailing.
If not, we're gonna have a lot to talk about.
Yep.
All right, everybody. So we'll talk to you later. Good night.
Bye, everyone.